yes, we have been doing a lot recently on digital technology. The kind of forums that I'm talking to you via today are exactly those kind of things that we've been using to care for our patients. And you may have read in some of the local press that during the peak of the COVID outbreak, we were actually caring for over 1,000 patients who had been in hospital or were very poorly at home. And so to be able to care for that many people via technology was really groundbreaking for us. It saved a lot of pressure that would have come our way in terms of the pressure on hospital beds. It was also better for very many patients to recover at home or to avoid coming in the first place. So we've got that very much in our minds as we look ahead at our digital transformation and talk with you and with our staff on what we want our digital future to be. And I hope for this session that we can really think about the what and the how rather than the where. So although some of you have come to this discussion because you're very interested in the site, the location of a new hospital, for this session we're really asking you to put that to one side and to hear about the kinds of technologies that we could use and how they will improve, we hope, patient care in the future. This session is being recorded, I should tell you that. You are all on mute. That doesn't mean that we don't want to hear from you, but we would ask you to send your questions in via the chat function. And those of you who are on our first sessions in June will hopefully have found a way to do that. We had lots of questions, so that's what we're hoping you will do. And this session also gives you an opportunity to give real-time feedback using Menti, which I do hope that you've all got to grips with. If you haven't, please stay with us anyway to see what other people think in terms of responses to questions. And we are going to look at a case study. Hopefully you've seen the film already that has Natasha in it. This case study that we're going to show you is a fictional case study, but I think really explains how technology can be used to improve care. And we're really fortunate to have Sean Gilchrist and Catherine Hammond with us, and they are really doing a lot of the work on shaping our digital future. And we also have Dr. David Gaunt, who will be here for some of the questions. So a fine team to introduce you to, and we're going to kick off with Sean, who is going to talk to you about Doris's story.
Good evening, everyone. I'm Sean Gilchrist. I'm the Director of Digital Transformation. Can you see me? Let me start my video. Apologies. It is not allowing me to start my video. I'll try again.
I should just say that Sean has just hot-footed it, if you can hot-foot, on digital technology straight from another meeting. So he was just here probably about the same time as we started. So I'm sure it will all come good in a couple of minutes. Please bear with us. What I would say while we're waiting is the code for Menti is 105342. So hopefully you all have that. I'll say that again. That's 105342. Sean, do you want to speak to us just so that we can check that we can hear you okay? So I think what we'll do, just to keep us moving, is if we can share the screen, and I think possibly my colleague Priya can share the screen, and then as David is with us, we could maybe just go through Doris's story, if you're happy to do that, David.
Of course.
Thank you. If you can share those slides. And I will just explain that Doris is a patient, a frail elderly patient with dementia and diabetes. She lives in a care home, and David is going to talk through a story, imagining that she has all sorts of technology at her disposal, which is exactly the kind of thing that we want to have in our new hospital buildings. And you will get to see a little robot, and please don't think this is complete fiction, because in the last few weeks we have got robots in our pharmacy department. That's right, isn't it, David?
That's correct, yes.
Yeah, yeah. Okay.
I did see Sean actually pop back up again. I don't know whether you're
okay.
Sean. Okay. So if we can get some slides up. Positive. Anyone else able to share some slides on the screen for us? Ah. Grand stuff.
So I think we can probably go straight to 5.
Slide
Yeah.
5, please, if you wouldn't mind. Just one more for me. Thank you very much. Okay, so this is the story about Doris, who actually, she lives in her own home, and she's lucky, and she's got a monitored home. And after the family have been alerted that Doris has failed to move out of her bedroom as she would normally do in the morning, the family goes over to see her and finds that Doris has fallen out of her bed. They look on her patient portal to review the last time she was seen and whereabouts she often gets seen, and they find that she goes to Watford General for most of her care, and the advice from the clinical portal is to take her to Watford General. When they arrive in Watford General, they're given the option to either check Doris in via the self-check-in, as you can see from the photograph here, or they actually get a little prompt on their telephone, on their mobile phones, to say that that they've arrived in the A&E department and would they like to use their phones to check in. And once they've checked in, a wristband is printed, and it's got an RFID chip in, which enables the family and also the staff to track whereabouts Doris is within the hospital. Doris has her measurements, such as her weight and her blood pressure and pulse. Those are all automatically taken as she arrives. And the information about Doris and the severity of her current condition is all visible very rapidly to the nurses who are looking after the whole department, along with all the other patients that are present within the department, as you can see from this screen here. This helps the staff to be able to decide which patients they're going to see next. Doris has got a small laceration on her head that we need to dress, but before we do that, we photograph the wound using a smart device, and that image is then placed into her electronic patient record, so that anybody else is able to look, anybody else who needs to, is able to look at Doris's wound without having to undress this wound each time, leading to a much better chance of healing. Various tests are required for Doris, such as blood pressure monitoring and so on, but also the GP notes are immediately available, and it determines that it turns out that Doris has diabetes, so blood sugar levels are automatically requested. She also went to the GP a few days before, and various tests were ordered by the GP. These are automatically added into her the tests that are requested from the hospital, so that she doesn't need to have further blood tests at another time. Doris is going to be admitted to the hospital, and on the left you can see one of the dashboards that enable the hospital to monitor the number of patients that are in different wards, the number of beds that are available. It turns out that Doris had a COVID swab a few days ago that was negative, so she's able to move into one of the COVID negative areas. And also, when she becomes more unwell and requires an urgent CT scan, the wristband that she has on means that we know exactly whereabouts she is, and the porters are able to attend her very quickly to take her to her CT scan. She needs admission because of the problems that she has, and she's admitted to a dementia-friendly room. This has various facilities, such as the ability to know whether the cot sides are up or down automatically, and to see whether she's moved from her bed, at which point the lights will automatically go on to aid her getting to and from the bathroom, for example, overnight, but also will alert the staff if she's moving. And there's our friendly robot on the right, which will be able to bring supplies to and from the ward, giving the nurses more time to care for their patients. Having an electronic patient record means that all the information is there for all people. So if there are 3 or 4 people wanting to see her records, now what happens is everybody's fighting for the drug chart, which may well be in pharmacy being checked, or looking for the notes which are being looked at by the physio or the pharmacist or the junior doctor. Now, of course, everybody has access. All those people who require will have access all at the same time. It's useful to be able to coordinate her discharge plan, and her discharge date is decided on arrival in the A&E department using clever algorithms that look at her previous admissions and other admissions for other patients who have had similar problems, to be able to work out exactly when she's going to be going home. She's also able to keep in touch with her husband, Fred, who's too frail to come to the hospital. And she's able to use video conferencing very much like we are using now to be able to keep in touch with them. Her discharge is coordinated by all manner of staff, including the GP, who will be able to work together to be able to make sure that she is safe when she goes home. When she is discharged, she's still going to be cared for by the hospital in a similar way to what we're doing now with devices that will keep an eye on blood pressure and blood sugar monitoring, as well as being able to have virtual consultations, as we are doing now with software like Attend Anywhere. When she goes home, as I say, she'll have these virtual follow-ups, which her family are able to help her with keeping in contact. But she obviously will be seen by the district nurse, who is able to look at her wound and ensure that it's healing. And it's the integrated devices that she has will be able to let the staff in the hospital know if there are some issues that are occurring, such as her diabetes care going awry, or if her blood pressure becomes higher, the staff will be able to be alerted quickly in the hospital.
Thank you very much, David. That was really a very quick canter through, but really interesting to understand the possibilities. And on the back of that, we're just going to have some questions now from Catherine, who's going to ask us questions about how we would feel about using similar technologies, and we're going to capture your results in real time. So over to you, Catherine.
Thank you, Louise. Hi, everyone. My name is Catherine, and I have a set of questions that I would like to ask of you to understand how you would want to use technology, how you use technology currently now, and how you would like to use technology in the future as it relates to managing your healthcare and the healthcare of your family. So the first question is asking if you or your carer currently use either a computer, a tablet, or a smartphone for shopping, banking, or health services, such as ordering repeat prescriptions. So to answer, you can go to the website www.menti.com using your phone or your laptop or your tablet and use the code 105342. So the code is the same. We've got about 10 questions we'll ask of you, and the code stays the same for all the questions. So see, we've got 9 votes that have come in so far, indicating that 89% of the people that have been able to vote do currently use technology such as computer, tablet, or smartphone to do online shopping or do banking, checking your bank account, transferring funds, or access health services. Got 12 votes coming in. I think we've got a few more people that are participating, so it would be great to get a few more votes, and then we can look at the next question to allow a couple more minutes for people to find their way to Menti and answer this first question. About 13 coming in. So the next questions really dig into how you feel about using technology for different sorts of things and what your preferences are, as well as providing some feedback directly on what considerations you have and what you would like. And then after the Menti questions, we'll have an opportunity for you to ask questions of any of the topics that you've heard through Doris's story or that if we've raised through the Menti questions. Okay, so thank you everyone for voting for this first question. We've got 13 votes. I'll move on to the next question. Okay. So the next question is about your future preferences. So would you or your carer use a computer, tablet, or smartphone in the future if it helped to support your health care? It's got nine votes so far. 12. It's 92%. Most of the group would like to use a computer, tablet, or phone in the future to support managing their health care. Okay, thank you for your votes. So the next questions will really think about how you would like to use your computer, your tablet, or phone. What might be the most helpful? What of all the different options, all the different technology possibilities, what do you think will be most useful and most convenient for you when you're thinking about accessing services at West Harts or managing your healthcare when you're not at the hospital, preparing for your visits, communicating with your clinical team, those sorts of things? Okay, so thank you. We've got 16 votes so far. It looks like almost 90% of people would like to use a computer, tablet, or a smartphone, but there are 13% of the respondents that would not like to use the computer, tablet, or smartphone in the future. Okay. So now I wanted to ask you how you feel in terms of your level of preparation and the amount and type of information that you have. So do you feel prepared and have enough information before coming to the hospital for either an outpatient appointment, surgery or procedure, or any other type of care? So after this initial question on whether people feel prepared and have enough information, we'll be asking you if you would, if you don't feel prepared enough, and if you would like more information, what that information would be. So what are the situations or the questions that you might want to have answered, or the further information you would like in advance of coming to the hospital? So we've got 12 votes coming in so far. About 60% of the votes indicate that people would like more information and they would like to feel a bit more prepared before coming to the hospital. Okay, so thank you to everyone who's voted. I appreciate the staying with us and submitting your responses. So now we'd like you to take a minute and think about what support you would like to feel better prepared. What information would you have liked to know, thinking back or thinking to the future, before you've come to the hospital to help you feel better prepared for your visit? Whether that's being able to understand the physical layout, viewing a map, or being able to take a tour, understanding what's going to happen, what tests might be required, what the purpose of the visit is, how long it might take, who you might see. Please let us know any support or any further information you would like to feel better prepared in advance of coming to the hospital. Okay, so one person has indicated that they're happy with the level of support, which is good to know. Someone else has indicated that they would like to know if they're going to need a test as part of their visits, who you are going to see, what times, and how long will it take. Questions around what will happen during the appointment. Will you see different people? Where will you go? What to bring, what the next steps are. A map, the ability to pay for parking in advance. Accessible patient information, the likely outcomes of the visits. A few other people indicating they would like to understand who they will see and how long, the timings, how long will the appointment take. Okay, so thank you for this. Okay, so the next topic that we want to get your thoughts on is a technology option called the patient portal. So a patient portal is a secure online system that allows you to look at information from your hospital record, from the record that David mentioned that the clinicians will use at West Harts to manage your hospital appointments. So you'd be able to book and reschedule and receive appointments if you find that helpful, to receive test results that would be appropriate to send directly to you, and receive and send messages from your hospital care team. So it would be available all the time. You could log on to your secure patient portal using your computer, your tablet, or your smartphone. So you could use it for yourself, of course, as well as for a family member if they'd granted you that permission. So for a child or an elderly relative or anyone that you're caring for that is giving you permission. So there's lots of ways that you could use a patient portal. So I wanted to ask you to let us know, what ways would you find helpful? What would you find useful to do in a patient portal? So we've got several different options. We actually have 2 votes on this. You can vote for all of these if you find all of these options are helpful. So I'll just explain them while people are voting. So one of the ways in which you could use a patient portal is with your appointments. So you could log on and you could look at what appointments you've got coming up or what appointments you've had in the past and be able to request to reschedule and receive reminders if you'd like that. You could fill in forms on the patient portal before coming to your visit, which could be used during the visit to help inform the consultation or the appointment. You could look at clinic letters or discharge summaries from your previous appointments and hospital stays for a reminder, as well as information on what's previously happened to you and what the next steps with the treatment plan is. You could look at records of past procedures that you've had. You can also look at laboratory and radiology results, such as results from a blood test or an X-ray report. And you could use the patient portal to help communicate with your consultant and your clinical team to ask questions you might have about your conditions or your healthcare. Or you could check your recorded allergies that you have on record as a reminder of what the team is aware of that you're allergic to. So thank you for the 12 people that have voted. I'll allow another minute or so for anyone else who's completing that's thinking through what they might find useful. It looks like all of these options people would find useful, with a few of them being a bit more popular in terms of booking and rescheduling appointments, completing forms such as a preoperative assessment, viewing results, helping with your communication. Okay, so thank you for the 15 people that have voted to let us know which of these options you'd find most useful. So we have other options that you could do in addition to the first set that we'd like to get your views on similarly. So the next options are, which you can, again, you can select all of these if you're interested in all of these. So the first option is to understand where you are in the course of your treatment and what the next steps might be, given your condition, given the plan from your clinical team. You could use the portal to view a video tour of the hospital to help you prepare, to really understand what to expect, what the layout is, what will happen when you visit the trust. You'd access personalized educational materials to help you manage your condition, follow-up care. So whether that's managing your diabetes or asthma, or preparing for a surgery such as a hip replacement, understanding what to do in advance, understanding what will happen after, what the recovery will look like. You could use the patient portal to receive that information. Help keep track of medications, as an understanding of what your previous medications were, what your current ones are. You look at videos to help you with recovery and physiotherapy. You could also use the portal to work out your travel plans with real-time travel updates to help you with the navigation to the hospital on the day. You could access information about what services are accessible at the hospital and understanding how to access different services. You could potentially use the portal to book transport to a hospital appointment. So thanks, we've got 15 votes. And I see that the most popular choices are understanding where you are in the course of your treatment and what the next steps are, and accessing that personalized material and personalized information to help you manage your care, as well as understanding what services are available at the hospitals, thinking about what information would be helpful and how you might want to access that using the support of technology. Okay, so I'll move on to the next question. So when you're thinking about physically being in the hospital as a patient yourself or as a visitor, there's options of using your smartphone or your tablet with a couple of different things. So it could be that you could use your device to help navigate the hospital and find your way around. If you're having to go to different places within the hospital, it's a big site, so you might want that support and how to get to the next location, or how to find a family member if you need to go to a specific area, which is sometimes quite confusing if since it's a large site. You could also use the smartphone or the tablet to look at and receive alerts on the clinic waiting times to understand how long you might have to wait for your appointment. Okay, so got about 13 votes so far, and of the 13 people, it looks like everyone who's voted would like to understand and receive alerts on the clinic waiting times. That's something that seems to be quite helpful. Got a 14th vote, and most of the people would also find it helpful to use the technology to help themselves kind of find their way around the hospital and navigate from one location to the next. Okay. All right. Thank you for voting on that one. So another topic that we wanted to get your thoughts on in terms of using technology with managing your healthcare is around what we're calling virtual consultations. So if it was appropriate, would you prefer to have the option of having an appointment with your doctor and nurse on the telephone or through a video call? So you've got a few different options of, you can indicate that you prefer the option of a telephone call. You'd prefer to have the option of video consultation. Either a telephone or a video consultation would suit you, or you would not like either of these options. So an important thing to note is that this would only be in situations that were clinically appropriate, that have been, okay, so about 13. So where you wouldn't need a physical exam, and it would be appropriate to have a visit not face-to-face through a video consultation or a telephone call. So a lot of considerations for this, which we can talk about in the Q&A portion, but some people do find the option quite convenient to have that option of not having to physically travel to the site for yourself or for a family member. Okay, thank you for the 15 people that voted so far. Okay, the next topic is about clinical monitoring at home. So as we saw at the end of Doris's story, where the clinical team was using technology to help monitor Doris's condition and her progress, would you find it helpful if your clinical team could remotely monitor your condition using information received from a digital device? And what digital device means is any kind of electronic device that can transmit information. It could be an electronic blood pressure or glucose monitor, an asthma pump. There could be a lot of different devices that you might be able to use at home that could collect information, and you could say it was okay for that information to be sent to your clinical team electronically. This might help to reduce the amount of times that you'd have to physically come to the hospital. Okay. So would you find this helpful if your clinical team could remotely monitor your condition using the support of technology devices that you'd use at home? Okay, so if 13 people, 14 people have voted, the majority have said that this would be very helpful, and a few folks said that this would be slightly helpful. Okay. You'd also think through how might that apply for yourself or your own family's kind of situation, because there's so many different possibilities given different conditions and different types of devices. We saw with Doris that the team was using a glucose monitor as Doris had diabetes, but there's lots of different options. Okay. So the final question before we go to the Q&A portion of tonight's session is around your communication preferences. So how would you like to communicate with the hospital and your clinical team? So please select all of the options that you would like. So the options are receiving letters through the post, or communicating electronically through secure email or through the patient portal that we talked about, or via telephone, so receiving telephone calls or using telephone to call. Okay. It's nice to see the real updates. You kind of see people voting and seeing what the preferences are live, which I find interesting. Okay, we got 15 votes. I think that's almost everyone that's been voting, so thank you for that. It looks like of the 15 people, everyone would like electronic communication options, and about half the people would like the option of telephone communication, and 6 of the 15 people would prefer the option as well of communicating through paper letters that are received through the post. So thank you for using Menti to feed in your preferences, your thoughts, your views on how you'd like technology to support you with your healthcare and with communicating with the hospital. So I'll transition back to Louise, and she'll help us with the question and answer portion.
Thank you very much, Catherine, and thank you everyone for that, trying a new technology. That's possibly the first time that some of you have used Menti, and it does just give us the ability to capture your feedback in real time. Now, I have an apology to make to you. I should have said that the chat name that I'm using tonight is WGH's iPad. Sorry, it's not very catchy, but it is WGH's iPad, and that will give me the ability to look at your questions and then put them to either Catherine or Sean, who I'm pleased to say is now with us, or David. So I do have a question that has come in already, and that is about the funding. So the question was asked if the funding is separate or as part of the capital. And we are continuing to have those discussions, but it really is something that we feel far more confident about. So when we were starting on this road with the redevelopment, we were very much bidding for money for the bricks and mortar, the sort of fabric, and now we feel that we've made the case very successfully that there should be money for digital as well, and that has been understood. I don't know if Sean, you want to say anything about whether it's a separate stream or if that, you know, if you have any further information on that.
So you're absolutely right, Louise. It is a separate stream of funding, and we're pursuing NHSX, NHSE, and I for monies for digital to support the new build.
Excellent. Okay. Just seeing if there are any more questions. So just to remind, they come into WGH's iPad. And I can't see any further questions at the moment, but one of the questions that came up yesterday was around a feeling that it had to be digital as a way to communicate with us. And the answer to that is no. For those patients who don't want to communicate using digital technology, there will be no, you won't be forced down that particular route. This is something that we find convenient for us. It's time saving. A lot of our patients are saying the same thing where we have been using it, and so we think that the take up will be very high. Some of you may be using these kinds of technologies far more as a result of the COVID outbreak and have got much more up to speed. So we think the take up will be good, but that in no way means that you will be forced to use this kind of technology. If a clinician feels that a face-to-face consultation would be beneficial, and if you feel that is beneficial for you, then we will still make those arrangements. So I can see that there are some further questions about the boundary between us and our partners within primary care. So that might be Herts Valley's Clinical Commissioning Group or Central London Healthcare or whoever is providing your care. So David, if I could ask you to explain some of the linkages with primary care and how well technology can work across different organisations with the patient in the centre, that would be great. Thank you.
Of course. At the moment, we within West Herts don't have an EPR, but of course, GPs have been using electronic records for many years. I won't go into the reasons why it's an awful lot easier to have an EPR in a GP surgery compared within a large trust. But we have very good access to the coded information within the GP records for those patients who have given their consent to this using a system called MyCare Record, which allows the clinicians who are looking after that patient to be able to access these records from the GP records. And gives very important information about diagnoses, drugs that the patient may well be on, allergies, and of course the very important aspect about end-of-life care and the wishes of the patient, who may well not be able to provide those in an emergency situation when they come to the A&E department. In the other direction, our GPs are all able to access the information about the blood tests that have been done and other tests that have been done within the hospital that are obviously already electronically recorded within our trust. So that gives that two-way flow of information between us and our primary care colleagues.
Thank you, David. Thank you. So I have other questions, and I think, Sean, if we can come to you to talk about the security of the patient portal. So obviously with all of this valuable information being in one place, people are worried about how safe that is. Is that something you can tell us a little bit about? Absolutely.
About 10 years, even 5 years ago, security wasn't in the forefront of people's minds when they designed IT systems. It is absolutely fundamental to what we do, and a key requirement for us before we purchase any sort of IT systems. So there are rigorous checks to make sure that any sort of software we buy is A, secure, and B, clinically safe. Actually, in the other way, clinically safe and secure. And so it would be absolutely tested to make sure that it is secure, and not only secure from malicious hacks and so on, but secure in the sense that only the most appropriate people have access to those records, so that there are appropriate controls in place to make sure that only the people who should be seeing those records see those records.
Thank you. And Catherine, if I could come to you with a question about our EPR, which is our electronic patient record, and please throw to Sean or David if you wish to, but it's about whether we will build our own or whether we will use one that's off the peg.
So that's a good question, because there's a lot of different options for how you can get this technology in terms of building it yourself or buying it from a supplier. So West Harts has decided that what they would like to do is to buy it from a supplier. So there's a few different suppliers that offer this type of technology. So the trust is considering which supplier would meet the requirements and would be a good fit for the EPR. So Sean, I don't know if you want to jump in and provide a bit more.
Thank you, Catherine. So a modern integrated electronic patient record is extremely complex, and in my opinion, and actually through some of the investigations we've undertaken, requires quite a lot of experience in that field and expertise. And so it is beyond our ability in this organization to build that type of system, even if it means sort of integrating the different elements. There are the costs associated with that versus the benefits of an integrated EPR that we purchase from a supplier, are far outweighed. So our preference, and we've said this in formal business cases, is for an integrated EPR solution.
If I can come in there, this is very similar to whether you buy a house or whether you build one yourself. Yes, if you were to build one yourself, if you had the ability, you would probably get exactly the configuration you wanted, with exactly the walls and the rooms, the right shape and the right size and so on. But the downside of doing that is the length of time it would take you, the expertise you would need, and the length of time that it would take as well. So really, although people often think of this as being the best way is to create your own, there are so many hurdles that need to be addressed as a result that it really isn't feasible in our circumstance.
Could I just add to that? So it's not just the technology itself, but the expertise to implement it and instigate the changes. So the transformational changes in relation to an EPR is not just a simple case of throwing software out there and it works. There's a whole organizations worth of expertise required to actually move us from where we are to a truly integrated and transformational EPR.
Thank you. And can I ask Sean if you could talk a little bit about how our system works with others? So the point being that people move around all the time. If they go to another part of the country, will the systems link up, and will they be able to find the patient's record easily? So it's how well systems talk to each other, even though they might be different software.
So absolutely. People may have heard of the concept of interoperability, and the idea there is that people can use various systems, different types of technology all over the country, but they interoperate, they talk to each other, and they share data in the most appropriate ways between the systems. And so there are national initiatives to implement infrastructure to enable interoperability. And so any of the modern tools that you now buy from suppliers have interoperability as one of their key features. So for example, a modern EPR would have tools that allow it to share data in a standardized way with other systems across the NHS. And I know that our regulators, NHSX, NHS-INE, make it a fundamental requirement for software vendors to produce their technologies in such a way that they interoperate. And that's a fairly recent, when I say recent, I'm talking about the last 3 or 4 years, recent development around systems. So it's absolutely hardwired into the way we work now.
Okay, great, thank you. And can I ask, I guess this is probably one that you would know about, Sean, but about power cuts. Obviously we have generator tests and all the rest of it, but can you describe how the system is fail-safe in the event of a power cut?
So are we talking about an EPR, or are we talking about power cuts in general?
I guess talk about it in relation to an EPR. If somebody was in a conversation with one of our doctors using digital technology, would any of that be affected by a power cut?
So the more modern the technology, so the more we've built in controls around power cuts. So power cuts affect different layers of technology. So if you lose a network and your application is still running, you may not be able to access that. So there are different ways to mitigate against power cuts, and the first level is having generators on our sites and resilient power, and we do have that. And in fact, I believe that our new build will look to have resilient utilities and far better than what we have at the moment. So that's absolutely fundamental. But in terms of the software vendors themselves, so a lot of technologies, including EPRs, are cloud-based services. And what they tend to do is they tend to distribute their services across a number of data centers. So if, for example, if one data center fails from a power perspective or from a connectivity perspective, there's another data center to pick up the load. And so there are resilient links to these different data centers. And we do have UPSs, uninterruptible power supplies, but those are typically in place to make sure that systems hold for a certain period of time and safely shut down so that no data is corrupted. But as I say, it's fundamental to the way we design our new hospital to make sure that utilities are there. From a software perspective and from a software as a service perspective, the people who we purchase our services from have multiple data centers as a way of resilience.
Thank you, Sean. So Catherine, I'd like to come to you next, if I may. We've had a question about the experience of Deloitte, who are working with us on this project. And it's not uncommon for the NHS to use independent experts. We're doing that on the site survey and other aspects of the redevelopment. Could you possibly give us a flavour of the kind of experience that Deloitte have in this field and your role working with the Trust on this project?
Yeah, absolutely. So I've been with Deloitte personally about 9 years, and my personal experience is focused on working with hospitals who are putting in new technology systems like the ones that West Harts is considering. So I'm originally from the US, as you can probably tell. So my initial experiences were working in the US to implement the integrated electronic patient record, what we call the EPR systems. I've been in the UK for about 5 years, and in those 5 years, I focused on working with NHS Trust to consider what technology options are best to help them weigh out the costs and the benefits, the pros and cons, all the different options, helping to put the business case together, giving advice around implementations. So my colleagues in my team have similar experience from the UK, working to implement different technology systems, thinking about all the risks, the lessons learned, what can go wrong, what are the key things to get right to make sure that the implementation is successful, because there's a lot of different considerations, whether that's from a technology perspective, looking at lots of different suppliers. And the other key challenge really is to think about how to implement change, and really how to think with the staff, with the clinicians and the staff around how do we do things slightly differently? How do we make the most out of technology? How do we make sure that everyone is trained, everyone's using the technology, we've got the right processes in place to get the most out of the technology, because it's a combination of technical options as well as the sort of the people aspects of change. So we bring that experience to West Harts to support and helping Sean and David and the Trust think about what are our options, what makes sense, what should we do first, what's the right approach, sort of how do we do this?
Thank you, Catherine. So David, I just wanted to come to you as you're very keen to really move us on in this sort of digital way of working. Do you think that a lot of the digital change will happen before we actually get to having new buildings?
Well, I do hope so, because if you imagine, we're designing new buildings now, and do we design them with a lot of space for paper, a lot of space for notes, or do we design them with lots of space for the IT and the technology? This obviously will make a big difference as to whether we actually do or don't have our EPR in place beforehand. Also, if you think about it, if we had to implement an EPR and a new hospital at the same time, the difficulties that would be associated with that for the staff, who would either be working in an old hospital with paper-based system and then suddenly moving into a new hospital and having a new EPR, I think those challenges will be enormous for the staff. So without any doubt, I'm hoping that one very much precedes the other.
Thank you. And Sean, I think you've touched on this already. It's about interoperability, and just to give some assurance that we are working within a national sort of framework. Can you just talk a little bit about NHS protocols for interoperability, and just to give some assurance that we're not kind of making it up in our own kind of West Harts way? That would be really helpful.
Yeah, so there are interoperability groups at various levels, and so we meet as a system under the integrated care system, and I'm actually the chair of the interop program for the ICS at the moment. And what we look at is we look at all those standards, and they're quite well defined in terms of what we need to do. And we look at all those standards, and we're on the cusp of going out to a procurement for the ICS to look for suppliers that meet those standards to implement. Interop is not just about working at a system level. It's also making sure that our local systems are able to plug into those national systems. And again, we're supported through national standards, which we have to comply with when we purchase our systems, and those help us plug into the national systems themselves. We've also done some work at an East of England level, under what we call the East Accord, where we're trying to collaborate with 5 other ICSs to make sure that we can at some point join up our systems with theirs and share information across the East of England. We're also conscious that a lot of our activity, patient activity, falls into the North London region, and so we're working closely with some of the organisations in North London to make sure that we can share our data appropriately with them as well.
Thank you, Sean. And I think our final question, so good to sort of end on a strategic note, is which of our 4 strategic objectives, or which of our strategic objectives does this help us meet? So we have 4 strategic objectives, and they are best value, best care, great team, and great place. And we put digital under great place. So although place makes you think about buildings, that's where we've put all of our digital dreams and wishes. And I think that is the right place for it, because we see great place as being buildings, but buildings that function really well to provide the best care for every patient every day. That's our vision. And so we do see this link between buildings and digital technology as being very, very strong, which is why we really want to talk to you about this at this point. So I know some of you really want to talk about redevelopment, but we feel that the 2 things can't be untangled. So that was a really great question to end on. So thank you for that. There is opportunity to send more questions. You know the redevelopment email. So we are updating our FAQs, and we hope to have our next FAQ on the website by the end of this week. You're keeping us very busy with that, but keep the questions coming. And we'll also be sending you the questions that you heard Catherine go through. So if you didn't get onto Menti, but you want to give us your views on those questions, please do that with the survey. And thank you to my co-hosts, and thank you to you for joining us. Thank you.
Everyone.
Thank you.